We have seen a lot of patients coming here in New York City turning out to be COVID-19 positive. We have unfortunately have a lot of people dying from COVID-19 in the city as well. Looking at our patients at Sloan Kettering, looking at in particular patients with multiple myeloma that I treat and follow every day, every week throughout the year, at the current time, I do actually not see that there is a very different pattern. I have not seen on average that these patients are put at a particular high risk. It is probably a little bit too early to draw the full conclusions. I would think that patients who are heavily immunocompromised may have different prognosis, but we have not yet been able to go through all the data. So we are looking carefully into that as we speak. When it comes to the management of the patients on a day-to-day basis in this era of COVID-19, we have taken many measures, and we changed a lot of things in our treatment of the patients. We try to do as much as possible in the outpatient setting. We stay away from inpatient therapy, in particular older therapies that cause cytopenia, because we don't want to have patients in the hospital. We also don't want to use blood and platelets because there's a shortage of that, and that needs to be safe for patients that do not have other options. For the patients in the outpatient setting, we have converted the entire program, and we almost do 99.9% of all the visits as telemedicine visits, and that actually works out very well. When it comes to the treatments, there are certain steps we have also taken there. We have switched all the infusional therapies. If they used to be twice a week, we now use once a week. And for those that go from once a week to less frequent doses over time, we try to go to those less frequent dosing schedules sooner rather than later. We inform the patients that these are not the established ways of doing it, but we have a conversation with the patient on the potential risk of being infected by the virus, and the patient is part of the decision making. I think it's very important to have the goal of the treatment and the care as the number one discussion point before any further treatment and monitoring decisions are made. As I will mention, we have stopped doing all the transplants. We don't collect even the stem cells. We don't want to impose any extra risk for our patients, and we will hold off for that. For patients who go on maintenance after combination therapy, we are offering these patients that we will, when the virus has cooled down, having them to come back in and to offer stem cell collection at a later time. And I do think a lot of those patients will probably not do the transplant later. They will probably have potential stem cells collected for potential later transplants. So the field is moving forward. We are trying to stay strong through this crisis, and we are using our clinical judgments to keep patients out of viral unnecessary exposures.